In today's video, I talked about botulism, which is my disease, and I had two interviews, one with two of us that are not really in the medical profession and someone who is in the medical profession. Mainly because I did realize that after editing the first video, I did use the name of the disease instead of the bacteria accidentally, so clearly I didn't know as much as the doctor did, but I hope you guys know a little bit more about this disease today. Everyone, today I'm going to be talking about botulism with John Paul over here. So John Paul, have you ever taken microbiology?
I have not.
Okay, so you don't know anything about bacteria now, so...
Well, I have a good idea about the basic things, but I don't know the fundamentals of bacteria.
Okay, that's good enough. Have you ever heard of botulism?
No, not until yesterday.
Really?
Yeah.
Okay, so it's actually quite commonly used in Botox. So
oh, okay.
Kind of the reason why I asked you to help me today, because you are in the cosmetic industry. It's one of the top things that is used in the cosmetic industry as of today.
Is it an ingredient?
It is. It's actually a bacteria that produces endospores.
And endospores are like...
So it actually makes it one of the most toxic type of bacteria. So inhaled, ingested, put into the skin, it's actually one of the deadliest bacteria. The CDC says it's one of the top 6 deadliest bacteria.
And this is an ingredient that we use in Botox.
Because
it attaches... preservative?
No, it actually attaches itself to the nerves, and that's what stops the facial movement. But it can also stop the person.
Why would somebody want to do this?
Because they want to look young, the wrinkles. They want to get rid of the wrinkles, the fine lines. That's why.
Okay. So I'm just really blessed. Like, I'm 32 and I've never had any plastic surgery, but I know a lot of people my age have, so this is something that I feel like I have thought about but not really investigated what it is, you know?
Yeah, Okay, so some of the signs and symptoms of botulism is dry mouth, difficulty swallowing, speaking, muscle weakness, face paralysis, and the face paralysis kind of ties into the reason why they use Botox in the face, because it stops the muscle movement there. So that's why they have found it is a neurotoxin, like that is the causative agent of the bacteria. So it is not commonly found in nature. It is found mainly in the Midwest is where they found it. And it's found in canned foods as of now, and bioterrorism is the only place at the time you would actually see the bacterium come ingested in the system through inhalation.
Wait, fast food?
Bioterrorism.
Oh, sorry.
And canned foods.
Sorry.
So anything with preservatives. Yeah, so anything with preservatives. And it's actually very toxic. 1 gram is 1.5 lethal doses. So it's one of the most toxic endosporic bacteria. It is gram-positive, and it's bacillus shaped. So bacillus is just
like rice, right?
Yes, there you go. So you do know a little bit.
Linguistics are my forte. This is why I'm surprised I haven't heard of your botulism word.
Oh, but you have, just not in the form
that
we're talking about. It does have 6 different forms.
I have heard of Botox.
To stop botulism, when you have the botulism poisoning, you go to the hospital, they actually can't reverse the effects. So what they do is they just stop it. I know, they just stop the effects through a heavy antibiotic.
Yeah, but isn't your face like totally screwed up?
Yeah, your body either has to naturally heal from it, or...
But it sounds like it's the most toxic bacteria, so how does your body...
So they first have to check you for it with clinical symptoms, or they have to do a culture, or they have to look for the antibodies in your system, but once it's progressed to a certain point, you might even need to use a breather in the hospital, yeah, and they have to do the IV of the antibiotics.
That's really interesting. Yeah, well, I'm sold on not doing Botox, thank you.
Well, I don't know, I would still do Botox, but... Okay. Alright everyone, so after yesterday realizing that we're probably not the experts on botulism, I found someone who actually might be. This is Dr. Kazemi, and he's going to help answer some of my questions about botulism today. So I'm assuming you actually took microbiology and know what you're talking about with botulism.
Not really.
Really? So can you tell us a little bit about this disease as far as how do you treat it? Like, how do you actually find it in patients? How do you treat it? And
so botulism is the condition that occurs after typically the ingestion of the toxin that comes from a bacteria called Clostridium botulinum. So this bacteria creates this toxin, which is actually one of the most potent neurotoxins ever. and typically it's found in foods that have been either been contaminated or have, due to bioterrorism, have been injected with this toxin. So what happens is when the toxin gets ingested, it usually gets ingested in the upper GI tract, and through that it gets access to the nervous system. And when it does that, it paralyzes these nerves by not allowing the nerves from secreting the dopamine and the acetylcholine, which typically is necessary in the transmission from the nerves. When that happens, this even leads to weakness or paralysis. And typically, the presentation is you typically have cranial deficiencies, which means you have deficiencies of the cranial nerves, the nerves that support the face, and also innervate the face, and you also develop a symmetric weakness starting from top going down. Whenever you notice that kind of a pattern, what we call flaccid paralysis, that's usually indicative of botulism.
So just to see if I got it right, it is a bacillus shape, right? And it's an endosporic type of bacteria.
So it's a gram-positive bacillus bacteria, yes.
Okay, so there's something I at least got right. And it is used in Botox, is that correct?
So yes, Botox is, most Botox use the actual toxin to cause the paralysis of that particular area. So when they inject the Botox into that part of the skin or the face, that eventually causes paralysis of that nerve, and therefore the reduction in the wrinkles in the face.
So I read that only really strong antibiotics can be used to stop the progression of the botulism. Is that true, like penicillin, tetracycline?
So the true treatment of botulism is actually supportive care. So if someone gets paralysis through botulism, the first thing they ask you to do is what's called respiratory intubation. So you intubate and basically put the person on a machine to allow to breathe for them. The main reason why is otherwise the nerve deficiencies cause your lungs to fail, and therefore you die. So it's all supportive care. So you support the heart, you support the lungs, you give them fluids and kind of make sure that they're fine. These patients do not have fever, so you don't have to worry about that. But yes, if you're worried about potentially a bacterial infection, not just the toxins, but actually getting rid of the infection because you think that this patient may be colonized, then yes, you can try to use antibiotics.
Okay, and it's not a very common thing that you can actually have, right? You have to inhale it, ingest it, or it has to be in the wound. And I read that it's mainly the Midwest that they have found some cases, but...
So it's also found, so it's usually found in the soil or in those foods. So a lot of times you get it in pre-canned foods and where it's been contaminated, like I said.
Okay, awesome. Thank you so much for answering some questions for us. I guess I knew a little bit, not too much. Definitely he knows a lot more than I do, but thank you so much for your time, Dr.